Thank you so much, Dave. Well, sit up straight and listen up. We've got Dr. Ellen Rame of Southeastern Spine in the studio with us, whipping us back into shape. Dr. Ellen, how are you?
Great.
All right. Well, some people aren't doing great because they're dealing with their back problems. Common pain is back pain, but what we're talking about today, not such a common name, and I can't pronounce it. I've tried already. It's known as arthritis in your back.
Yes.
Also known as?
It's called lumbar spondylosis.
How about that?
And it's one of the most common things I treat, actually,
Okay.
at the Southeastern Spine Institute. That is me personally. It presents most of the time. Patients say, you know, I have pain in my back. It's not usually pain going down the legs. Mostly pain centered in the back. Usually worse in the morning. Some people say, you know, it's worse when I get up, and then once I get moving around a little bit, maybe take an Advil, I feel better. And it's really a nagging sort of a pain that can be really quite bothersome to a lot of people. But there's some good options to help treat it. So
and I was just going to say, Dr. Ellen, you were just saying a lot of people, they go out and they just say, well, I took an Advil and I'm fine. But you don't want to live a life where you're dependent on taking a pill every day or an ibuprofen to try to make sure that your back pain is going away. So that's where you come in.
That's true. I mean, you know, to look at all the treatment options that are available to you. You know, in some cases, you know, taking a small amount of a medication on a daily basis is not entirely a bad thing. But, you know, there are some other interventional treatment options that we can do for this problem that can give people actually long-lasting relief. So, in general, what this is
I'll hold this for you.
The joints of the spine. You can see they're located on both sides of the lumbar spine. And by the way, you can also have this occurring in your neck as well. So pain.
So it could be all the way up to the top.
Yeah, sometimes even associated with headaches in the back of the head. But these joints on either side of the middle spinous process right here, you have joints on either side at each level. And these little joints, just like the joint of your knee or your elbow can become inflamed, these small joints can become inflamed as well. And that is, and also enlarged when they become inflamed.
Oh my goodness.
So that's really where the problem is, and those are really the areas that we're focusing in to treat. We can do injections of some steroid and local anesthetic into the joint itself, which can calm down the inflammation. And also we can do a procedure called radiofrequency or rhizotomy. And this is really an exciting procedure because it can give patients anywhere from 6 months to a year or sometimes even longer.
So some long-lasting relief, not just something that's going to fix it for a week or two.
Yes, exactly. You know, a lot of people are coming in getting epidurals or taking high doses of medications, and really, you know, something like this could be a solution to pain that's going on in the back, and give you long-lasting relief where you're not needing to take as many medications and you're not needing to come in as frequently for just epidural injections.
Right, and forgive me for my ignorance, Dr. Ellen, but I did not know that you could get an epidural. You know, usually you associate that with pregnancy.
That's a good point.
Or childbirth, but I guess you could do that as well.
It's the same space. It's a space outside of the spinal cord that lies over the spinal cord space in the lumbar spine. And in pregnancy, usually what we inject is local anesthetic. So like lidocaine and whatnot for C-sections and for labor pains.
For the time being.
Yeah, so what we inject when we do these under the X-ray machine in our office at our ambulatory surgery center is actually steroids. And the steroids stay in the space for a longer lasting period of time and actually decrease inflammation and help with pain for, depending on what your problem is, for longer periods of time as well.
It's like putting out a fire in your back.
Great analogy. Love it.
Yes. All right, Dr. Ellen, tell us where you're located very quickly and your new office.
Oh, yes. We're located on Chuck Daly Boulevard. We'll all be under one roof starting mid-April, and we're very excited. It's going to be a state-of-the-art facility. We'll be able to treat all of our patients' problems all under one roof. So
always excited to see you, Dr. Ellen. And if you have questions for Dr. Ellen, you could submit those on abcnews4.com. Just go to the Low Country Live tab. Dr. Ellen, a pleasure to see you again.
Thanks. Great to be here.
All right, we'll toast. No, not with your glasses. We're talking about the restaurant. And Chef Brett McKee is in the building coming up. Stay with us.